If you want to know the 10 most frequently asked questions about low testosterone, stay tuned because I'm going to be discussing the 10 most frequently asked questions that our clients ask us. I'm Brian Burke, and I'm the founder and CEO of Rewind Anti-Aging. And today I'm going to be discussing the 10 questions that our clients and people who call us ask regarding testosterone replacement therapy. Question number 1, how do you know if you're low in testosterone? I think that one is pretty simple. Number 1, we have a form on our website, which the link I'm going to put into the description of this video. So you can go to our website and take the quiz. And then second, there are some just sort of common sense questions you can ask yourself. Number 1, if you think you're low in testosterone, I think there's a good chance that you probably are low in testosterone. Number 2, has your libido decreased? Are you having a harder time staying in shape than you used to have when you were younger? Do you have stubborn fat? Are you having a hard time concentrating? Are you taking naps in the early evening? And so, I look at those just simple questions, and those are some of the things that happened to me prior to going on to testosterone therapy. I was lethargic, had a hard time getting into the gym. When I went to the gym, I didn't see the results that I used to see when I was younger. I felt like I was dealing with some type of low-grade depression where it was really hard to get motivated and, to get things accomplished. And so I think those are some of the ways that you can help self-identify whether or not you have low testosterone. Another question that I think this one is sort of funny is a lot of guys are worried that they're going to get super, big, bodybuilder big, and too muscular, and no one wants to look like a bodybuilder. And so we all sort of laugh at that. Our job is just to get our clients to the upper end of normal. So we're not talking about guys, reaching super physiological levels of testosterone. We're basically just trying to manage guys and get them to a place where they feel better. What that translates into physically is that if you go to the gym and you eat the right way, yes, you can be in really good shape. I'm 50 years old and I feel like I'm in just about the best shape of my life. And I think that a lot of our clients feel very similarly to me. But no, we don't have any huge, bodybuilder type of guys. We do manage a couple guys who compete in the IFBB. So that's sort of competitive, bodybuilding. But, smaller, the guys are more like body models. And those guys are in amazing shape. But they do just the standard dose. They're managed the same way that all of our other clients are managed. And yet they eat super clean. They work out very hard. And what it allows them to do is maintain the physique that they had, when they were in their 20s. Now as they get into their 40s and 50s, they're still in really good shape. So no, you're not going to be some, super huge Hulk-sized guy. So that's not even a big concern. Another question sort of related to that is, am I going to have a roid rage? And so, there's obviously a lot of stories in the past in the bodybuilding community about guys that have super high levels of testosterone having, roid rages. And of course, if you are abusing steroids and your levels are, a multiple of, or multiples of where they should be naturally, then of course, maybe you can have some, aggression. But in general, like I said, we're managing our clients to a much lower level. So for example, one vial of testosterone, which might last our clients 10 to 12 to 14 weeks, someone who's on some crazy steroid cycle, they might be taking that same vial in 1 week, 2 weeks, 3 weeks. So, and they might also be stacking with a bunch of other products. And so, might this make them aggressive? Yes. But in general, we work with our clients and no one has ever reported back having any type of, aggression. The next question is, how do you take testosterone? So there are three main delivery mechanisms. One is injections. So we have a lot of our clients that take injections. They all feel really healthy. Some guys are hesitant at first about the injections, but once they get going, it's really simple. It's not painful, and it's really, I think, a very easy way, to maintain testosterone. The other way is testosterone cream. There's testosterone cream that you apply twice daily, and again, that does a really good job of boosting levels. So a cream is a really good method. And then the third one is testosterone pellets. We're not as big of fans as testosterone pellets because we feel like a lot of guys metabolize these pellets differently, so it's very difficult to get levels locked in. And there are a lot of guys that will complain that those pellets sort of run out, not consistently at the same time. So we feel like that's a little bit more difficult to manage. So we tend to stay away from that. So those are the three main mechanisms of delivery. The next question is, how important are the numbers? And I would say, the numbers give us a sort of guide, but we don't really pay so much attention to the numbers because you can still have a moderate level of testosterone, but still be experiencing all of the symptoms of low testosterone. You can have low energy, you can have low libido, you could have a hard time losing fat, getting in shape. And so a number isn't the be-all, end-all. What it is it's a data point for us to utilize, but more importantly, we take a look at the symptoms. One of the things that we always think about is that we don't have a good historical data on someone's testosterone level. And so we're never certain what level they had when they were younger and when they felt better and when they were in better shape. That's one area that I wish that the medical community would sort of change, and we would start doing more proactive healthcare and running hormone panels consistently throughout our lives, because I feel like there would be a lot of good data which would show when people's health starts deteriorating, we would also see a deterioration in their hormone levels. And so again, numbers aren't the be-all, end-all. They're a general guide that we can use, but we really pay attention to the symptoms. And like I said, some of the primary symptoms are libido, energy levels, are people feeling depressed, hard time getting in shape, mental fog issues, and those symptoms are much more important than a number. So yes, do we use it as a guide? Of course we do, but we also pay close attention to how our clients feel and what people feel like prior to starting therapy with us. Another great question that we receive all the time is testosterone replacement therapy for life? And what I would say is this: there's a great book by a Harvard professor, Dr. Morgenthaler, and it's called Testosterone for Life. And, it goes along with what our philosophy is, which is if you have low levels of testosterone and you're a middle-aged guy, your body is not magically going to start producing testosterone again. So you basically have two choices. You take testosterone replacement therapy and you improve your levels, and your, life should improve. Your enjoyment of life will improve because, as I said in other videos, your libido increases, your mental awareness increases. You typically end up having an easier time building muscle, having more energy, and being in better shape. And so as a result of that, you have a choice to feel better, or if you don't go on testosterone therapy, your testosterone levels are going to continue to decline over the remaining part of your life. And, as a result, I think that your enjoyment of life is going to be lower than someone that's on testosterone replacement therapy. So yes, when you decide to start therapy, you might want to consider that it could be something that you do for the rest of your life, because most of the guys that are with us feel so great and so much better than when they started that they typically, tend to stay with us forever. Next question, which I think is also important and also adds to enjoyment of life, is my libido going to increase? And I would say that absolutely the majority of our clients report back that their libido has improved. I would say personally, my libido is much better now than it was when I was in my early 40s and when I had low testosterone and when I was obese. And so, yes, most guys will experience a better libido. So, that's a benefit. That's a really good benefit. And it also, I think, will improve your enjoyment of life. The last question is this going to help me lose weight and get in better shape? And this question, I think, is sort of complicated only from this one perspective. We can't control diet and we can't control exercise. And you can certainly be 18 years old and have amazing hormone levels, but you can still be not in great shape if you sit on a couch and you play video games all day and you eat potato chips. So, in general, yes, I would say our clients experience much better health. They come to us because they're low in energy and they're having a hard time getting in shape. So these are a bunch of motivated guys that come to us. And then when we improve their hormone levels and they feel better, they go to the gym, they see better results. It incents them to go to the gym. So I'll say that they're on a positive cycle. And in general, they start feeling better. And so as a result of feeling better, they clean up their diet a little bit. And yes, in general, you will end up having much better energy levels. You will end up in much better shape. It takes some time. For some guys, it could be 2 months. For other guys, it could be 4 months. It could be 6 months. It could be 12 months. But I really believe that when someone, the majority, probably 99% of the clients that we work with, when we look back after 12 months, the person that is with us now is in dramatically better shape than they were before they joined us and before they started testosterone replacement therapy. So those are our most frequently asked questions. If you thought this video was helpful, do me a favor, smash the like button, subscribe to our channel. We have a lot more good information coming out about testosterone replacement therapy, hormone replacement therapy, and all things anti-aging. I'm Brian Burke, and I will catch you at the next episode.